Welcome to Design to Thrive, the podcast where innovation meets impact in healthcare. Today, we're joined by Megan Antonelli, the powerhouse behind Health Impact Live. From sharing the stage with Chelsea Clinton to leading conversations that shape the future of digital health, Megan dives into her journey, the evolution of healthcare tech, and how storytelling, community, and purpose drive lasting change. Let's get into it.
Welcome, everybody, to Design to Thrive. We have a special guest, Megan Antonelli from Health Impact Live. She's here to share with us today her story, her origin story, how she came to be with Health Impact Live, where it's going now. We'll deep dive into the future. Hi, Megan. How are you?
Hi, Ngoc. How are you?
I'm well, thank you. Thank you for asking. Not too bad.
Yeah, thanks so much for having me on the show.
You're welcome. I'm glad to have you on. Let's kick things off light. What's one recent event that you hosted with Health Impact Live that really moved or surprised you?
Well, I'd have to go back to our January event. We had Health Impact Live in New York. It was actually just the day after the inauguration. And we had Chelsea Clinton as a keynote speaker. And, we kind of had hoped to have a different outcome where we would be celebrating the first female president alongside her. But it was still amazing and inspiring in the work that she does in healthcare with her venture studio, Metrodora, and the companies that she supports. It was amazing to have them there. And then coupled with that at that event was also our charity partner, Road Recovery, who supports teens and adolescents going through addiction and adversity through music. And they gave us such an amazing performance with Simon Kirk, who's on their board. And he kind of through storytelling of his story with addiction, but also he's the founder of Bad Company. And so incredible story of, people he's met like Bob Marley, Paul McCartney, Ringo Starr, and then singing his own original songs, just, showing, which is what we like to do at Health Impact, showing the impact of both music and connection to improve patient lives. So that was really probably, it was a highlight, not just of the year, but really for a health impact, ever.
Wonderful. That event was definitely good timing, eh?
Yes, for sure.
Okay. Yeah. Things didn't work on the election for you. I'm sorry to hear that. But that one event definitely showcased him as well, right?
Yes, absolutely.
So mental health. Are you focused on mental health? What do you focus on in your Health Impact Live events?
Yeah. When we started Health Impact, it was really about leveraging technology to make an impact in patient lives. And that was in 2012. So it was like right when meaningful use started. Obviously, many health systems already had electronic health records, but a lot were homegrown. And now came the time where, the incentives were in place and they all started implementing. So it was really to get there to help both, mid-sized, large practices, large hospitals, mid-sized hospitals get those electronic health records in place. And so we brought together the CIOs and the CMIOs who were really working on that. Of course, fast forward, you know, 10, 15 years, technology touches every part of the organization in healthcare. So we have, while we are still very much a CIO forum, we, invite and amplify the programs that are being implemented across the healthcare, hospital ecosystem, whether it's finance, obviously security, and, having, what's going on the security side, but, clinical work as well, and where that, where clinical work is touched by and amplified by technology.
Beautiful, yeah. So what first pulled you into the world of healthcare, innovation, and tech? Was there a turning point?
Absolutely. I think I always kind of grew up wanting to be a doctor. I was good at math and science. With the recent, the new show, and then taking me back to the ER days, I remember that. And that was kind of, sort of formative, wanting to work in a hospital. And then I actually did. And I realized I didn't really want to work in a hospital. But I realized there was a lot wrong with it and that
Yeah.
there was a lot to be fixed. But I ended up getting a job in events while I was getting my master's in public health. And doing those events was on Medicare and Medicaid managed care mostly. It was actually at the time that Medicare Advantage was coming through Congress. And it was really kind of a pivotal time and watching how that regulation was going to impact practice. So the policy impacting the practice of medicine and the practice of care, both on the pharmaceutical side and the payer side. And it really, it kind of just hooked me. And I was always kind of in this space where I was very interested in that intersection between the payer, the provider, and the pharmaceutical industry. And I stayed in events for a long time, but then I worked at Kaiser. And right when I was working at Kaiser was actually when HIPAA was being implemented and they were working on their electronic health record. And after that, I worked at WebMD. And so I was actually at Medscape when WebMD bought them. And so I was really at these, just by chance, these amazing places where technology was having a burst in healthcare, right? And then I went back to events and worked on that, but really always trying to find where I wanted to be and what I wanted to, there uh, where the technology was going and kind of getting ahead of that. And that's what you had to do with events. And then again, Health Impact, we launched right at that time, sort of a critical point where electronic health records, took over. And, here we are.
Perfect. Isn't WebMD like Dr. Google?
Well, it was the first Dr. Google, right? It was. And, and at the time, so Medscape, which is interesting because of course WebMD was buying, and acquired many companies during that time. Medscape is one of the only ones that really retained what it was from the beginning, which was the professional education site. And it was one of the first internet professional education sites. But what we did there was we actually certified accredited it for the first CME online. So becoming that, and now it's, of course, we're looking at how AI is going to be changing medical education. There's so much going on, but Medscape is still doing what they were doing then, as is WebMD.
Beautiful, yeah. So back to your role at Health Impact Live. What's day to day like for you?
Well, it looks a lot like this, actually. I run, since the pandemic, we've had our podcast, the Digital Health Talks podcast, and that's just been a great way to kind of continue our conversation all year long with our attendees and experts and partners. And, it's also just a great way to meet new people too. Back when I started, and I won't say when because I don't want to age myself that much, but I was faxing invitations. We still had emails, but we would fax letters of invitation to speakers. Because not everybody would answer their emails, not everybody used email. And it was so now, and then we would have a lot of phone conversations. Of course, most of my job was on the phone talking to people, asking them what their challenges were and what they would, what would make them attend a conference, what they needed in a conference. Um, and now it's a lot harder to get people to respond to an email or talk on the phone, but they will when they are invited to a podcast. So we've been doing a lot of that. I do a lot of research, a lot of writing, and a lot of just connecting, and that's what it looks like.
Okay. So for the term of how many some odd years that you've been operating at Health Impact Live, how many people have you impacted
Well, that's a great
so far?
question. I mean, we say tens of thousands. We have sort of a subscriber list of over 25,000. The event itself each year brings together about 250 at each event, and that's always like my favorite sweet spot. I think when you go up beyond really a 300-person event, it just gets too big. They serve a purpose. I love trade shows. I love big conferences, but that sort of the intimate size of 300 for 2 days allows you to really engage and interact. So, but I don't know. Now we have the podcast and the
Yeah.
our YouTube channels, and so there's a
Yeah.
there's a lot more reach than just the in person event now.
Okay. And how many events do you host per year?
So right now we're doing two per year. We do one in January, one in June. We actually have several dinners we hold throughout the year, but as far as the big events, we're doing two. And that's been since the pandemic.
Yeah.
Prior to the pandemic, we were probably on a more of a four per year. But I'm of the thought that there's a lot of events, and so focusing on making the few that we bring to market high quality is the best way to work on it. And now we also have the virtual stuff to kind of keep that conversation going.
Perfect. Do you serve filet mignon at your dinners?
At those dinners, we sure do.
Okay.
We have a varied menu, but there's always a good filet on there.
For your view, what tech is shaking up healthcare the most right now or in the next 5 years?
Yeah, I mean, that's a good question. Healthcare moves slowly. It's certainly been moving fast in the last 5 years, but I kind of look at it like the technology we're implementing and excited about now, we're going to see the impact of it in 5 years, right? It's so complex to kind of manage and measure the impact. So I think right now what we're seeing is the impact of the fast adoption of telehealth and virtual health during the pandemic, right? I mean, we had that huge sprint based on necessity, and now it is the norm, right? People want it, people need it. I know that there's a possibility that it will get taken away and that it won't be reimbursed in the same way, but I don't. I mean, I'm confident that it will stay, and I think that we're seeing that impact. What it means to have that access to care, to some specialty care that has been harder for people to get, and then the convenience of preventative care that we didn't have before. Right. And of course, right now we're watching AI adoption at this escalated pace and this acceptance of it. It's not new. None of this technology is brand new, but that acceptance of it that has come with, the craze around chat GPT and large language models, and we're watching in certain places that have impact, right? The early adopters seeing positive results, but we'll see real impact, across the healthcare system, I think in a few years. Maybe it'll be faster than 5, but you know.
Now, you already shared your event about the previous time in January where the elections are going on. What's one initiative or event that you've led that you're especially proud of?
You know, if I have to think about what I'm most proud of in terms of the events that we've done at Health Impact, I mean, I think that our ability to kind of pivot and stay relevant and connect people during the pandemic is probably what I'm most proud of. I mean, we were scheduled to go to Hims for our dinner and a one-day event on, March 7th of 2020. And by March 13th, we launched our first virtual forum. And we took that one-day event and we put it on Zoom. And I didn't know how to do that, and neither did my team, but we made it happen. And then we had our first full-fledged custom, health impact the summer of 2020. And we did a lot of fun things, and we, sent out mail kits and all those things that kind of became almost rote by the end of the pandemic with the virtual events. But we did a lot of that, and it was fun. And it was not a fun time, but it was we met but we managed to kind of keep things going and connect people telling stories of amazing work that they were doing and amplifying that, because no one needed help more than the healthcare workers during the pandemic. So being able to share stories of how organizations were able to scale their workforce, and bring their workforce online during that time so that others could do it, it felt like really important work. So it was amazing. And then, of course, going virtual that quickly and being able to pivot allowed us to then stay afloat for what became, certainly didn't expect, almost 2 to 3 years where we couldn't do a in-person event.
So I guess that ties back to the mission of the organization. Like, what's your mission changed since the pandemic? What's your mission today?
Yeah. I mean, it really hasn't changed. I think that we started to show and amplify the good work that people are doing in healthcare, and, really to bring together health systems who often were, siloed within their own organizations, let alone not necessarily communicating across organizations, to be able to share in ways that would allow them to move faster. Right. Healthcare, you don't want to add additional risk to healthcare. It's already risky enough. You don't want to disrupt healthcare more than it is already disruptive. So being able to implement proven technologies that others have done and learning from them quickly, is the way it needs to be done. And that's always been our mission and continues to be.
Perfect. Now, where do you see the biggest opportunities to level up what you're doing right now?
Gosh, that's a great question. I mean, Events are a tough business. They're very sensitive to the economy. And when things get uncertain, travel and things get tough, I think having that virtual backbone for us really helps make sure that we remain relevant and we're able to connect people throughout uncertain times. And then I will say that, local following that we have in New York and that New York location allows for us to, bring folks in as cheaply as they can get in. um, and I can't not mention our conference chairperson, Shahid Shah, who is just, he is an incredible MC. He understands the market. And in uncertain times, there is no one you want to hear from more than someone who really is able to kind of discern the hype, cut through the BS, and, help health systems and all of their partners navigate, this time. So I think we have, challenges ahead for sure, but luckily we've got some really great folks who are able to help people navigate, these sort of uncertain times and during a period of really rapid innovation and adoption, which is very exciting. It is adoption during a resource strained time is never.
Right, right. Now, what's the big picture vision you're building toward with Health Impact Live?
Yeah. I mean, global domination.
Oh yeah.
No, I have been doing this for a long time and I believe in quality over quantity. And while I want to see health impact grow and the brand grow and our reach grow, those events, just kind of remaining true to them and bringing together high quality people for high quality conversations and being able to amplify those conversations on the channels that we use. So we by no means maximize those channels in terms of our podcast and the blogs and the things that we write. And so, I really want to see us just getting more consistently, amplifying the content that we and the voices and the stories that we capture, getting those out there and getting more people to listen and learn.
Now, this ties into my next question. Could AI play a role in content creation, personalization, or even outreach for your community?
Absolutely. I mean, it already does. I mean, we are using it to help amplify as well as create some of that content. I mean, it was nearly impossible to take a 45-minute panel discussion and turn that into a coherent, story before. The level of which the person listening had to take that content and kind of take what speakers said, take and create the context from outside to create summaries. It was hard, and we're a small, tiny organization. So using AI to do that has been amazing. To be able to tell those stories, to summarize those stories without having to listen and re-listen and listen and re-listen to 45-minute panels. Each event produces 36 hours of content, and that's a lot. And to invest the money to turn that into the stories is tough, but it can literally be done in minutes now. I mean, particularly we actually our venue at Microsoft, we use Teams and Teams captures it and Copilot will summarize it. And it's an amazing thing to see after really having paid hundreds of people over years to create, okay summaries. These are, they get it. And we still need to involve intelligent humans to kind of bring the stories to where they touch the outside. But the summaries that we can get are pretty amazing.
Okay. And finally, I have one last question. After everything we unpacked, what type of AI tools or solutions do you think that will move the needle forward most for your team?
Well, I think that there's a lot of tools that are coming out. They're not all perfect. You know, but being able to use some of these tools and particularly ones that are trained for your own, some niche use, become so the more highly specialized those tools are, the better that they are. So we use a suite of them. The design tools have helped a lot, and so I think there's a number of them, but as I'm excited to see how they're going to become more specialized and that we'll see tools that are geared towards literally, doing that, taking event content, summarizing it, taking, summaries of podcasts and summarizing those and turning them into your social bits and your amplification tools that get the eyeballs where people are.
Okay. Well, that's it for today's episode. Thank you so much, Megan, for coming on the show. We'd love to have you on again. That is Designed to Thrive. We'll see you again.
Awesome. Thanks, Ngoc. That was great.